so this is Dr. Amig, your friendly rheumatologist, and today we are talking about methotrexate. So your doctor wants you to start methotrexate. What does that mean? So first of all, know that we know methotrexate for a very long time. It's a very old drug. It is, if you start looking at internet, you're going to see that it is a chemotherapeutic drug. Please do not be afraid. The doses that we use in rheumatology are like baby doses. It is absolutely not the same than the doses that are used in chemotherapeutic drug. And so because of that, please know that the side effects are completely unrelated. Like they are related, but they are very different, much, much milder. However, because methotrexate is the process is to stop the proliferation of cell, including your immune cell, there is some complication that you need to know. A lot of them we can actually prevent, and I'm going to tell you how to do this. Okay, so first things first. When you take methotrexate, the goal is to decrease the immune system and the proliferation of cells. And because of that, you actually can develop some nausea, some abdominal pain, very rarely some vomiting, but it is definitely a possibility. And that is because basically all the cells in your body that proliferate fast are actually your hair and your gut and your skin. But the skin, it doesn't really cause too much issues with methotrexate. So you can have loss of hair and you can have gut issues because of this. And we have a way to prevent that, so please do not worry. But those would be like the most common. You can then develop a low cell count. So you can develop anemia, low white blood cell, and that again can be prevented with another thing I will tell you. I feel like you have to stay here until I tell you what it does. I can tell you right away, it's folic acid, it's a vitamin. But yeah, no, continue and follow me. So we talked about the risk of low cells. We talked about the nausea, abdominal pain, the hair loss, and then it can cause liver toxicity. Those are like the main side effects. Let me tell you though, that it's okay because we have a way to prevent this. So the first thing is the folic acid. What does the folic acid do? Folic acid is a vitamin. And what it does is that it literally is the antidote of methotrexate. So you're going to tell me, wait, why are you giving me methotrexate, but you're also giving me folic acid? Like, it doesn't make sense. Well, and that's exactly the question that some rheumatologists a long time ago, I think it's more than 20 years ago, asked. And they were like, no, I'm not going to ask my patient to get folic acid. But the truth is that the patients who were on folic acid seemed to and did do better because they were actually able to continue the methotrexate. So then they did a study looking at, if I take methotrexate and folic acid, one, does it decrease the efficacy of methotrexate? And two, does it decrease the side effect? And they found that it does not decrease the efficacy of methotrexate, which is remarkable given the fact that it's literally the opposite. It does the opposite job of methotrexate. But what they also found is that not only it does not decrease the efficacy of methotrexate, it also prevents the side effect. And so now it's standard of care for anyone that is on methotrexate to have folic acid. And we recommend 1 milligram per day. I have some patients that need a little bit more. So in terms of those, the other thing that I have seen is the ulcers in your mouth. You can actually develop some ulcers. Again, same thing, because actually your mouth, your tongue, it's all the digestive organ, so it replicates fast. And a way that actually doesn't necessarily make complete sense, but work to prevent the oral ulcers is to actually take your folic acid and just switch it and like just keep it in your mouth so that you put it all over into your mouth. That is something that has worked for some of my patients. I don't know if the folic acid works directly here. It's locally, it doesn't necessarily make sense, but since it's working and it doesn't hurt, might as well give you this trick. Now, in terms of the liver toxicity, how do you prevent that? Well, there is one way that I always tell my patients, that's a pretty easy way. is to remember that methotrexate is, that the liver is an organ that regenerates, okay? So it actually regenerates constantly. And so if it regenerates, then a way to make sure that it does its job at regenerating is to say, well, I'm going to give the methotrexate only one time per week, and the rest of the week, I'm going to allow it to regenerate for the liver, right? And so that's actually exactly what we do. We take methotrexate 1 day per week. The rest of the day, you don't need methotrexate. And so you take, we usually start at 6, some people start at 4. You take 6 tablets of 2.5 milligram, or you take 0.6 injection, and you do it once a week. And the folic acid is every day, right? The other thing is to realize that, yeah, you need to leave some time for the liver to regenerate. So if you drink alcohol all of the time, you're not letting your liver to regenerate. So we are asking not to drink. So some non-French, clearly, people would say you cannot drink at all. There are actually some studies that are showing that very minimal amount of alcohol is totally fine if you drink, if you take methotrexate. Just know that the glasses in the US are much larger than the glasses in France and Europe. And the other thing is that it's not every day. If you drink every day, that causes an issue because you're not allowing your liver to regenerate. Same thing with the anti-inflammatory. If you take NSAID a lot, you may want to cut back because you don't want to cause any harm to your liver. Again, allowing it to regenerate. Those are the reason why we also recommend blood work. And we are going to start blood work once a month for 3 months, and then every 3 to 4 months after that, once you have reached a stable dose. All right? Because we're going to look at your blood cell count, and we're going to look at your liver function. All right? So those are like the main thing. If I have to summarize, you want to take the methotrexate once a week to help with the GI symptoms, so the abdominal pain, nausea, so on. You take folic acid every day. You can also split the dose of the methotrexate if it's an oral, if you take it orally. So you split it with morning and end of the day, or sometimes my patients, they do end of the night, the day before and the morning of. You can split the dose. And then you can also take sub-Q. Subcutaneous, so those are injections that will help the GI issues. And then you want to make sure that you take it only once a week, and that you take folic acid every day, and that you do blood work once a month for 3 months until we have a final stable dose, and then every 3 months afterwards. Overall, super well tolerated. Okay? Well, I hope this was helpful. If you're looking for a rheumatologist in the Denver area, I would love to see you. And otherwise, I wish you a wonderful day. Take care. Bye-bye.